My name's Billy. I live in Oshawa, Ontario. I'm an outreach worker through the AIDS Committee of Durham Region. I went to university and studied clinical immunology and biochemistry, specializing in HIV studies. PrEP stands for pre-exposure prophylaxis, which means that it is a drug that is taken prior to exposure to something, in this case, HIV. You can think of it kind of like birth control. It's a pill that you would take once daily for as long as you need to, and as long as you take it, it protects you from HIV if you become exposed to it. I am on PrEP because I like having that line of defense against HIV. I was recently in a polyamorous relationship, and as a result of that, I did have multiple sexual partners, and I felt that having that comfort level of knowing that if there was a condom failure or if a condom wasn't used, that I was protected from HIV. I've been on PrEP for a little over a year now. I started through a post-exposure prophylaxis after an HIV exposure, and then my infectious disease doctors that were handling my post-exposure prophylaxis, and I decided that I would continue on as a PrEP person. Nope. To date, I have always tested negative for HIV, and along with the prevention methods I used, I'm going to stay that way. No, PrEP is really only indicated in HIV-negative men, although the drug itself, Truvada, that's used for PrEP, is also used to treat HIV-positive patients to keep them undetectable and healthy. The drug itself, as PrEP, is designed for HIV-negative men to keep them HIV-negative. Being on PrEP doesn't determine who you're going to have sex with. It simply is a method that you're taking to protect yourself, just in case you happen to be exposed to HIV. It doesn't matter whether or not your sexual partner is HIV positive and undetectable, HIV positive detectable, or actually has AIDS. The PrEP is designed to protect you from infection from the virus. Currently, to date, the amount of men who have sex with men who have taken PrEP and have had barrier-free sex is phenomenal. At this point, we're looking probably hundreds of thousands of sexual acts. Many of those people are choosing to have sex with people knowing they're HIV positive, or having sex with people who are believe they're HIV negative, but perhaps are not. And it's well over 99% effective at the prevention of HIV. Currently, there have only been 2 seroconversions in over 4 years of use. That actually exceeds the protection level that condoms provide. There are many reasons why people may choose to not wear a condom during a sexual act, either with a person they know or a completely random individual. If you're not going to wear a condom, there's risk involved. And whether or not it's because you went out and had a few drinks, or you're placing your trust in somebody that perhaps you just met, or you're placing trust in somebody you've known for a long time. In many of these cases, HIV transmission can occur. So having PrEP as a backline defense if you're using condoms, or as a frontline defense if you're not, basically ensures that you can remain healthy for the rest of your life and not have to worry about contracting HIV from anyone. And PrEP itself doesn't determine whether or not you should or should not wear a condom. PrEP only protects against HIV and not any other STIs. The decision to wear or not wear a condom in any sexual activity is completely personal and should really not be judged. I would say that at best, if you are uncomfortable having sex without a condom, then wear one. In general, PrEP is designed for people who are already considered high risk for HIV. So in general, they may not be wearing condoms with each sexual act, or perhaps they're in a monogamous relationship with a partner who is HIV positive. In these cases, the decision to wear or not wear a condom should really depend on personal comfort level. PrEP is a really good barrier to protect against HIV in these cases. The side effects of PrEP, when you first start taking it, can cause a bit of stomach upset, but that usually only lasts for a couple of days once your body adjusts to it. There are rare chances of it causing a minor lowering of your kidney and liver functions. When you go to your doctor and your doctor prescribes PrEP for you and continues with monitoring your health through it, what he'll do is he's going to test your liver and kidney function. If at any point that he determines that it might be lowering, all that's required is you simply stop PrEP, and there's never been a case where your liver or kidney function hasn't returned to normal. The long-term effects of the actual drug itself have been very well studied. The drug itself, Truvada, started to be used in HIV-positive patients in 2004. To date, there have been no serious or damaging side effects that have not been able to be reversed by simply stopping the drug. Yep. I attend the Lakeridge Health Positive Care Clinic for my care. They deal with all of my STI and HIV testing, as well as testing for my liver and kidney functions every 12 weeks. And being able to have access to that resource as an HIV negative man has been really, really helpful. I would say one is being honest with yourself about your own risk level and being honest with your healthcare providers about your risk level. If you are using condoms for every sexual act, getting tested regularly, your partners are getting tested regularly, condoms are effective. You don't really need PrEP in these cases. But in general, if you have many partners, if you don't know the status of your partners, and you may not be using condoms as often as you maybe would like, or for whatever personal reasons you're simply not using them, then getting on PrEP can keep you healthy and can keep the other people that you're sleeping with healthy as well.